Hi guys, welcome to Operation Theatre Tech study vlog. So here we are discussing about patient positioning at Operation Theatre. Sorry, Operation Theatre. So after a patient came into the OT, right? So before the OT, the patient should be in pre-operation mode and with NPM, right? So after entering OT, he or she should be positioned on bed according to operation need. Why? So that operation site exposes better for surgeon. So when after this position would be done, right? So this is the main question. So this portion is the later portion. After entering OT, he or she patient should be remain supine position for anesthesia. So all the procedure here done. Here all the procedure done after anesthesia, right? So this is the procedure we have done after anesthesia. So how much the position are doing? So let's take a look about the positioning done in OT. So right, so first of all, the position named supine position. We discuss later about the position. Nextly comes Trendelenburg. Third, reverse Trendelenburg. Sorry, I have reverse Trendelenburg. Then it's the prone position. Then come chair position. Then come lateral position. Then come So here we take a look about the six and a couple of position done. That is lithotomy, position, right? So here is the seven position have mainly used in the operation theater in for doing general surgeries as well as orthopedic and gynae obs and all the surgeries, right? So this is the main positioning doing in the OTs. So now we would like to describe all the position with you. So first of all, taking the first position, that is the supine, right? So coming to the position, supine position. So supine position, the patient should lay down on OT bed facing towards roof. So when a patient, here is the OT table, that is we can think as a OT table. This is the portion. So we can, if we change the color, this is the OT table and this is the patient, right? So this is the patient. So patient. So he facing towards the roof, then it is called the supine position, and the hand remains towards the angle of 70-degree approach. So this is the main portion, one of the main portion, the hand towards body even 70 to 80-degree approach, as if it does and so, then high probability of pressure necrosis. Why so pressure necrosis? Because the arteries and veins towards the body to hand is so this is the reason, and that is a tanning. That's why the pressure necrosis happen, right? So after the point, would like to go is a prone position. So this is a reverse position of supine position, that is called prone position. Here the face would be down, nextly body and hand angle would be same 70 degree. Not, it would not be 70 degree exactly, it would still be lesser than 60 degree approach, because the reason is the same. So that's why this thing happen. So when we can think it as, so we can think it as this is the OT table, right? So this is the OT table and patient. So where is the black? So it is his head, right? So this position would be like this. So the position would be like this, and this approach would be laser there. Sorry, Laser than 60-degree angle. So this is called the front position. After the position, we coming to that is the lateral position. Okay. So coming to the third position, that is a lateral position, right? So now the patient facing towards the wall, right? Towards the wall of the OT chamber. And very important, this is the most important part, that is or heart. His or her one leg should bend towards his front. That is exactly not what bend. I didn't recall the exact word. That is like his he face like this. This is the wall, right? So he face like this and right this, and his one leg would be like this, and nextly would be like that, right? And his hand, and one more important point, that is he is in between his hand a pillow should placed. So why the pillow should be placed? That is because his chest is a, so this is your arm and this is your chest, right? So in between the two arms, to fill the gap, we have to place a pillow in between his two arms, so that the proper positioning happen, right? So this is exactly the thing we have to do in OT. This is not the word which you have been told in the classes. So it is important for the practical purposes, not for the theoretical purposes, right? So coming to the fourth position, that is, so we have done brown position, lateral position, supine position. So we have coming to the lithotomy position, right? So lithotomy, so coming to the point, lithotomy position. Coming to the point, lithotomy position, the patient body, this is very critical, one of the critical positioning done in OT, right? So you have to think it very carefully. So the patient lies down as supine. Think it. The patient lies down as supine. Firstly, right? Then his or her leg ups, right? So then his or her legs up. So how is like this positioning? So the this is the OT table, right? This is the OT table, and you can get the positioning table. So this is the positioning table. So the here is the patient, here is the patient, and this is his leg, right? This is his leg. So uh, he should be up his leg and positioning like this in between. So if you see longitudinally, then this should be placed like this. So this is the OT table. Here is the head, here is the patient hand. So here is the both the for ups the leg. We have to attach couple a set of fracture table to so this is the position. So after completing all the position and discussing about all the position, we have to know which is the position we are going to use for which OT. So we have completed fourth position. Then we are thinking to Trendelenburg position, right? So here is the position of Trendelenburg position. So here is the position of Trendelenburg position, right? So how to maintain Trendelenburg position? So Trendelenburg position is like the here is the patient. If here is the patient head and this is his leg, we are seeing vertically, not longitudinally. He should be remain same as supine in the longitudinally. He should be remain same, but you can't see any change of supine position in the Trendelenburg position. But the bed, the operation table should not be same here. The operation table would be heads up and the legs down for this OT. So this is the OT table, this is the OT table, and here should be head up and legs obviously down. Then it should be referred as a Trendelenburg position. And now, so we completed the Trendelenburg position. The reverse Trendelenburg position, the reverse Trendelenburg position would the reverse of this, right? So one more thing we have to add, that is the here, that is the this side off and this side should be down, or the reverse could be happen. That is a heads of legs down always. And for operation need, sometime we have to do in the Trendelenburg position, and same as the reverse Trendelenburg position, that is we have to off right side and down left side, right? So this could be reversed, and this would not be the same, this could be reversed. So coming to the reverse position, reverse Trendelenburg position, here obviously the patient lies down like this, and this is his leg and this is his hand, right? So this is the OT table. So here should be heads down and that is the legs ups, right? So this should be referred as the reverse Trendelenburg position, and this is also applies here because this is the operation need procedure. So this could be done in the reverse Trendelenburg position too. But if you could remember Trendelenburg position, then reverse Trendelenburg position would be the very easy to remember for you, right? So now we are discussing about, so we have completed 6 position among 7, and now we have to complete the chair position, right? So we have now the chair position, and we are discussing about chair position right now. Right, so right now, so what is this is the chair, right? And think one should think to sit down like this, right? Here is your hand, so one should think to lie down, to sit down like this, right? This is the thought of all of us, to sit down, right? But in the same case, in the operation theater, one patient should lie down like this, then this is called as the chair position, right? So how we think this is the chair position? This is the obviously OT table stand. So head should be up, obviously the OT table should be broken as chair, legs are down always, knee should be up, and obviously hip position should be down. So exactly this is the chair position. So exactly this is the chair position we are going to use for a couple of OTs doing in the OT table. So the positioning is looking like a chair, so this is called as a chair position in the OT. So right now we have to think, and we have to know what is the position used for which OT. So we, as example, we can think, and we, as an example, we would like to add couple of OTs, that would be orthopedic, gynae and obs, then general surgery, then ENT, then eye, then dental as well. So coming starting from the dental, from the last of the row, that is, so we think, and we're dentist, when a dentist going to the patient, here is the dentist, right? So if he goes to the and watch the patient's mouth, and with his torch and with his instrument, then the patient should obviously sit down like this. If you think very closely, if he lies down like supine, prawn, supine position, then the dentist should not able to see the proper exact site where the problem is. If the patient should lie down like prawn, then the dentist would not be able even to see his face. If he lies down like lateral position, then the face should be like towards the wall, so he would not be able, the dentist would not be able to see properly and examine properly your mouth, right? So if we position like lithotomy, then his work and his examine your mouth, right? So here is the no point to high your legs, high up your legs, and Trendelenburg position, he would not be able to see it properly. So for that reason, if you are going to the dentist and he asked you to lie down on the chair, then you can think that the chair is a exactly the push back chair, and the OT table would like to be fracture table, as well as fracture table would be like easy chair. So it named as the uh, chair position, and obviously this is mainly used in the dental OT. I am not telling that this position would not be used for any other options, any other surgeries, but this is the position mainly used to examine in your mouth. So this is mainly used in the dental, not in the dental OT. It is actually the dental examine. So as it's, and this position also used a couple of various types of OTs too. This position, if hypothetically, if doctor thinks that your throat, examine your foot or examine your knee properly, then he should be positioned you like the chair position. So this is the thing, this is mainly used for dental examine and the examine purpose, not for used in the OT, but not usually used. So coming to the position, reverse Trendelenburg and reverse Trendelenburg position, you obviously see a patient in a laparoscopic. This position is both the position is used for laparoscopic OT, right? So this is the main point used for the laparoscopic OT. So why we have to think why this is used for laparoscopic OT? We later we have to know about the couple of procedure of laparoscopic OT. Then we have to know why. So this is the position used in the laparoscopic OT. So exactly, if we think very not very detailed, but if we think very overview, then this is the position. Here is the diaphragm, right? So if we so this is the position of the laparoscopic hole, and we position here port, and here we placed the laparoscopic camera, right? So if we want to see, here is the gallbladder. So for gallbladder, we taking as a case as a GB OT, right? So seeing the gallbladder from here, we have to raise up head, then we can see properly the exact position of the gallbladder, right? So for that reason, the Trendelenburg position used, and the reverse Trendelenburg position as a sample when here is the position of the appendix. So for the appendix, lap appendix case, we go detail in the later of the period, but as an overview, we have to know the position so we can take it as detail. So here is the position of the appendix. So for that reason, so taking another color, right? So for that reason, we place the lab camera from here to here to see it properly. Then the legs would be higher up. So then we used this. And another for before, for GVOT, we have to take this. So for that reason, we have to take its Trendelenburg and use Trendelenburg position as the mainly for OT. So coming to the point of lateral position, before we coming to the point lateral position, taking a lithotomy position, right? So here we discussing that the patient should be remained at the supine position, but there's a one clause, that is his legs should be high up, both the legs, for both the legs should be high up. So here I have mentioned, and here also I have mentioned how the legs would be high up. So why this type of what is done when we have to examine the anus or anal position, right? So if a couple of times we have to the doctors have to examine the anals for various reasons. So for that reason, and this is also used for the vaginal OT. So for that reason, the patient should be positioned as the lithotomy position, that is the highest up, and the body from head to hip, that the upper body position actually should be like supine, but here is the one clause, that is the both the legs should be highest up, and in between them a space available. So for the place of anus and the vaginal place and position of the patient should be examined properly, right? So coming to the point, that is the lateral position. So for that reason, this position, the lateral position, used for the various reason, that is for if aged patient, anesthesia should be given like this. So aged patient anesthesia should be given like this, and a couple of OTs, if your hand, upper hand, that is a upper hand, that is the, if you think properly, that is a fracture of humerus, then we have to plate it with the, we have to fix it with the plate, then if you position the patient as a supine position, then the fracture would not be covered with the plate properly. But in this case, the patient properly positioned, if with the lateral position, then the doctor is able and the orthopedic is able to examine the fracture site, as well as to fix the plate properly. So it is also used for ENT, that is for ear operation, for a couple of various types of ear operation. The patient should be positioned like this. Now we are taking as a prone position, right? So for the prone position, the patient face should be down, and here should be remain same as the supine. And here we know about the detail at previous, but for which OT we have to do this type of position for a couple of positions. That is mainly this position done for the next for the spinal surgeries, because if you are not like to do the patient like this position, then for the spinal surgeries, then how would you like to reach spinal cords for spinal cord fracture of spinal cords broken, and how would like to reach the nearest position and nearest exposure should be from the back of the patient. So here is the position, that is the spinal for the spinal surgeries. The patient should be positioned like this. And for various types of surgeries, also for various types of surgeries, but this is the main surgeries I have covered them, because this is the one of the main surgeries. Then if you are able to know about this, then you able to think about all the surgeries very specifically and very easily. So I have mentioned about these surgeries, and for various types of surgeries also doing in this position. That is if you have to take a skin graft, right? For skin graft, sorry, a skin graft from the patient's leg, from posterior side, then the patient should be positioned like this. So we have completed the prone position too. Right now we have to go in the supine position, right? So the supine position mainly used and commonly used in the OT chamber, right? It is mainly and commonly used in the OT chamber, because this is the position doing everywhere in OT. Because at first you have to taking the patients into the OT, you have to position the patient like the supine position. So this is the position for the supine position. And we have knowing the details at previously, but right now we have to complete couple of know about couple of OTs which is used supine position of the patient. So first of all, we can think that is a elusive, that is a mainly called a Caesar, and that's a baby born operation. The patient should be a position like supine position. That is a hysterectomy. Then mainly general, lots of various types of general surgeries. The patient should be like this and this in this position. So here is the patient positioning on the details of all the OTs I have mentioned. Hopefully they should be informative, and if you like the video, then obviously please like and subscribe to this channel, and hopefully you will enjoy in this channel, and hopefully this should be informative video. So if you like this video, please subscribe and share, and obviously share with your friend and your colleagues. So thank you.